In Mid and South Essex, we're exploring the benefits of joined-up working in health and care through the eyes of local people. Jason, a former journalist and author, is in his 70s and lives in Essex. Up until 15 months ago, despite past health issues, Jason was able to manage his health well. He kept active and had even considered joining a local wild swimming club. After an unexpected spell of ill health, Jason suddenly became unwell.
On August the 1st last year, my world collapsed basically because I was rushed into hospital with a pulmonary embolism. So I'm quite independent, I'm very independent. I could never imagine my life not looking after myself and being in my own flat and doing all the things with my grandchildren that I like doing.
So Urgent Community Response Teams is a collective of community teams that respond to urgent or crisis needs for patients. So our response times are within 2 hours, so we will go out, assess the patient in an urgent health or social care crisis, do an assessment or carry out an assessment. We could treat, we could do bloods and put a plan in place for those patients. We have in the teams a collective of nurses, paramedics, physios, occupational therapists, as well as healthcare support workers.
They can go out and see patients that have got maybe mobility issues. They can get urgent equipment in like commodes, hospital beds if required. We also at the moment are having high referral numbers for falls. We've got a great bit of equipment called a razor chair, so we can pick patients up that have got non-injury falls. We also take a lot of referrals for GPs or nurse specialists at the hospital for urgent blood testing to try and keep patients at home as much as possible.
We also work collaboratively with partners, so like social care, to assist in terms of if it's a social crisis, we can arrange a package of care, for example. In worst case scenario, we could assist, or social care could also help us in terms of assisting for somebody to go into respite, for example, just for those few days until they're back on their feet or their baseline.
I was actually referred into the service, the urgent response service. I was just amazed. I mean, I've often said that some people feel your pain, and they obviously did. They were actually quite ever so good on that way. Most nurses are, but these were absolutely exceptional. And I felt almost quite like I had exclusive nursing, which I did to myself. So to have this sort of service available to me, if needed, means a hell of a lot.
Delivering better integrated care in the community has meant that staff can provide more personalised care, tailoring support to meet Jason's needs, prevent ill health to help people like Jason take control and retain his independence, and achieve better outcomes by providing urgent care in the community.
You're avoiding an attendance to the hospital or A&E, you're avoiding, hospital admission. You're also helping with the system pressures, so reducing the need for an ambulance to attend, so they can free up the time to go and attend perhaps somebody with more life-threatening emergency. And you're keeping people at home, closer to home, and promoting independence.
Mid and South Essex Integrated Care System. Together, we can make the moments that matter.